You've seen the ads. Free gym memberships, vision, dental, even cash back. But what if I told you it's all just bait? When Medicare launched in 1965, it was simple. No networks, no hidden fees, just care. It sounds like an upgrade, but it's really a privatization. Insurance giants get paid to manage your care, and they make a fortune doing it. These companies aren't just insurers. They own the doctors, the pharmacies, the data. They control it all. It's called upcoding. Make a patient look sicker on paper and get paid more, even if care doesn't improve. It's not just dollars, it's people. Denials of care aren't glitches. They're part of the business model. They spend millions on lobbying to keep the system intact. And it's working. Medicare isn't broken. It's being looted, but it doesn't have to be this way. So what exactly is Medicare Advantage? It's a private alternative to traditional Medicare. Instead of the government paying your hospital or doctor directly, it pays a private insurance company to do it for you. These companies like UnitedHealth, CVS, Aetna, and Elevance promise more coverage, lower premiums, and added perks. And that's true, sometimes. But here's what they don't advertise. They get a fixed amount of money per enrollee, and the less they spend on your care, the more they keep in profit. The profit machine. Let's talk money. Medicare Advantage is a $460 billion industry, and it's only growing. UnitedHealth made over $22 billion in profit last year, and more than half of its revenue now comes from government programs. How? Because the system rewards diagnosing more, not treating more. It's called risk scoring, a formula that pays insurers more for sicker patients. So they upcode, they assign more diagnoses, often with the help of AI tools or in-home assessments. Some of it's accurate, a lot of it is exaggerated. Denials, delays, and narrow networks. While the coding inflates, the care often shrinks. These plans use narrow networks, limiting your choice of doctors. They require pre-approvals for treatments, and they deny care more frequently than traditional Medicare. A government audit found that Medicare Advantage plans wrongfully denied services in over 1 out of every 10 cases reviewed. That's not a bug, that's a feature, because every denied test, scan, or rehab session saves the company money. This is what it looks like to try and see a doctor under Medicare Advantage. I created this digestible flowchart to visualize the process. You don't just make an appointment. You start by checking if your plan covers the type of visit. Then is the doctor even in your network? If not, it's not covered or pay out of pocket. In other words, stop. If they are in network, you might still need a referral, which means calling you PCP, waiting, then hoping it gets approved. And if it's denied, start over. Appeal. Find a new provider. Lose more time, all while you're sick, injured, or just trying to get basic care. And if you make it through all of that, you might still get hit with a surprise bill, because the visit wasn't fully covered after all. I've had to deal with this exact mess. I remember needing a specialist last year, only to find out the dentist I was referred to was out of network, even though the practice was in network. I got different answers to this problem over the course of 3 months from different people. Eventually, I just gave up. And that's what a lot of people do. They give up, not because they want to, but because the system is designed to wear you down. Here's what makes this even more complicated. The insurance company might also own your doctor. Companies like UnitedHealth and CVS Health don't just sell insurance. They own clinics, pharmacies, billing systems, and even entire physician networks. It's called vertical integration, and it means every part of your care, from who you see to what prescriptions you get to how much the doctor is paid, can be controlled by the same company. That's like going to court, where the judge, the lawyer, and the jury all work for the same corporation. It might sound efficient at first, but with any glimpse of actually looking into this method of practice, you'll immediately see it creates massive conflicts of interest.
A drug company and pharmaceutical company publishes a study, it's more likely to be in favour of that product compared with a study that was done by an independent fund that didn't come from any particular point of view.
The more care they control, the easier it is to cut costs by steering patients away from expensive treatments and toward whatever makes the most money. So if Medicare Advantage is costing more, denying care, and boxing patients into narrow networks, why hasn't anything changed?
The allegations are part of a lawsuit filed against Aetna, Elevance Health, and Humana. On Thursday, the Justice Department said the three insurers paid hundreds of millions of dollars to brokers to boost enrollment in their Medicare Advantage plans. In statements to multiple news outlets, Aetna says they are reviewing the complaint but don't agree with the allegations, which they plan to defend vigorously.
The companies behind these plans have built a massive lobbying machine. In 2024, UnitedHealth spent over $12 million lobbying Congress. CVS Health, just under $11 million. They hire former government officials, they fund campaigns, and they write the rules that are supposed to regulate them. When Medicare tries to tighten audits or adjust star ratings, the companies don't comply, they fight back. Take Elevance Health. When a rule change threatened their Medicare star rating and the $500 million they stood to lose, they sued the federal government. And to be honest, this isn't unique. Earlier this year, UnitedHealth was sued by BlackRock, not for denying care, but for providing too much of it, because too much care meant lower profits for investors. That's the system, where giving patients more care becomes a liability, not a virtue. It's not just the healthcare industry. Every major privatized sector does this. I just watched an incredible video essay by the YouTuber Wendigang. Check out his channel if you haven't. Very detailed and engaging content. In one of his recent videos, he breaks down how Fiji Water used backdoor lobbying and shady tax deals to protect its brand, all while draining a poor country's water supply. So no, these healthcare companies aren't special. This kind of corporate behavior is everywhere. But it is worth calling out, because in this case, it's not just about water or brand image. It's people's lives, it's taxpayer dollars, it's the healthcare safety net for millions of Americans, and it's being treated like a commodity. So where does all of this leave us? We've walked through the promises of Medicare Advantage. More coverage, more perks, lower costs, and we've seen what that really means. A system that profits more when it spends less on your care. A network designed to confuse, delay, and deny. Corporate giants not just selling insurance, but owning your doctor, your pharmacy, your data. Billions in lobbying to protect it all. And lawsuits when anyone tries to fix it. This isn't about one bad plan or one greedy CEO. It's about what happens when healthcare becomes a business strategy instead of a public good. And the impacts are real. People giving up on care they need, doctors burning out, taxpayer money flowing into corporate profits instead of patient outcomes. I felt it. Maybe you have too? And the truth is, most people don't know what Medicare Advantage really is until they're already stuck in it. That's why this matters, because this isn't just policy. It's people. It's your parents, your neighbors, yourself one day. Healthcare shouldn't be a maze or a marketing scheme. It should be care. And right now, it's anything but.